Rebecca.
Oh, sorry, just give me one sec. Am I on share screen here?
Yes, you are. Oh,
I
sorry.
didn't realize I get to control the slideshow. Okay. So thank you for having me. I'm glad I'm allowed to speak today. The first thing I want to address is pardon?
No, go ahead.
Oh, sorry, I thought you said something. So the first thing I wanted to address is when you silenced me last month, you not only silenced me, but you silenced almost 4,000 people who voted for me. And that you should be very ashamed of yourselves for. Now, this will be the last time that I address this committee, as I have a business to run and a family to care for. But let me be clear, my voice will be heard because I don't need this platform to have my voice heard. I'm here today to give you the chance to do the right thing. So please listen up, because this is the last time I will address you in this manner. Now, many of you tout trust the science in the face of opposition, but you rarely cite the science that you tell us to trust. So today I'll be going through some facts and data from your very own taxpayer-funded government websites such as niagara.ca, ontario.ca, canada.ca, as well as the CDC. Now, Mayor Sendzik, I know you like to mock those who do their research on the internet, but perhaps if you utilize some of these sites, we wouldn't be in the dire situation we find ourselves in today. So I've prepared a slideshow for the public review and for the public record and for your review. As you can see, each slide contains a source link to government data, so please feel free to verify everything I say here today. There we go. So if you recall, on April 13th, 2021, I addressed this committee regarding the fraudulent use of PCR tests at the St. Catharines Hospital. I referenced, sorry, I'm having a hard time flipping through these. I thought that you guys controlled the slideshow, but anyway, so I referenced a peer-reviewed study which stated anything over 35 cycles will produce 97% false positives. I notified you I had proof that the hospital was set to 45, yet to this day, none of you have requested this proof. Since then, the CDC has released a lab alert stating that anyone stating that as of December 31st, 2021, they are no longer recommending use of the PCR test. Why? Because they can't differentiate between COVID and the flu. I am not sure how to get, okay.
Just let me know when you want to advance, Rebecca.
Oh, perfect. Okay, thank you. I thought I had, okay, that's amazing. Okay. So now this would certainly, as I said, it can't differentiate between the COVID and flu. Now this would certainly explain why there were only 79 cases of the flu reported in 2020 compared to 54,000 in 2019. Now it's clear and obvious to anyone with critical thinking skills that the flu didn't disappear, it was simply misclassified as COVID-19 thanks to the PCR test. Next slide, please. But not only have you used these faulty tests to justify lockdowns, which are creating more disparity than the virus itself, but you've also used them to justify mandating masks, which according to Dr. Hergy will increase the risk of infection if reused. Now, I don't know if he is completely out of touch with reality, but everybody is reusing their mask. So by Hergy's logic, mandating masks will spread the virus. So our socioeconomic well-being has been destroyed by lockdowns. You have everyone wearing dirty face diapers, which Dr. Hergy says will spread the virus. And now you're relentlessly pushing everyone to get vaccinated with an injection that is ineffective and causing more harm than good. Now, some of you will call this disinformation. So let's take a look at some data, again, from your own government websites and see if this is disinformation or simply an inconvenient truth. Next slide, please. So let's talk about the vaccines and ask ourselves, should everyone be getting it? Next slide, please. Now, these graphs are taken right from the Niagara Region's website and represent the total cases and total deaths in the Niagara Region up to January 7th of this year. Now, at the bottom of the page, you will see a formula for calculating the mortality rate, which is simply the number of deaths divided by the number of cases. In this example, we'll calculate the rates for those aged 0 to 39 years old. Now, you can see on the chart, there are 3 deaths in this age group during the entire pandemic. So you take the 3 divided by 13,086, which is the total number of cases, and you get 0.0002. You multiply that by 100 to get a percent, and you end up with a 0.02% mortality rate. The flip side then, of course, is a 99.9% recovery rate. Next slide, please. Now let's have a look at some numbers from Ontario, which represents over 14 million people. Now I'd like to draw your attention to the green arrows. These numbers reflect the cases and deaths for the 40 to 49-year-olds. And the reason I chose this age group is because it represents Mayor Sendzik's demographic, Next slide, please. So the Government of Canada states that vaccination is one of the most effective ways to protect our families, communities, and ourselves against COVID-19, and that they are very effective at preventing severe illness, hospitalization, and death from COVID. Next slide, please. Yet here's an example of a very unfortunate story where one retirement home resident died from COVID-19 and 30 residents tested positive for the virus, all fully vaxxed. Next slide, please. Here we have another example in Newmarket. 15 fully vaccinated people tested positive for COVID, and sadly another man died after suffering 2 strokes, being ventilated and put on life support. Now these are just 2 examples of many that prove the vaccine is not very effective at preventing serious illness, hospitalizations, or death from COVID. Yet we have investigative journalists such as Grant LaFleche who constantly blame the unvaccinated for straining the healthcare system. So let's take a look at some of Grant LaFleche's work. Next slide, please. Now, this handy little bar graph, as you can see at the bottom left-hand corner, was created by Grant himself. Now, I believe the intent was to reflect the strain that the unvaccinated are putting on the Niagara health system. Now, I will note this is an outdated graph, but let's take a closer look at some of his figures. At first glance, one might conclude the unvaccinated are putting a major strain on the healthcare system. But upon further investigation, you will notice that this graph represents 30 people in 3 hospitals over a 15-week period. So you can see by my calculation on the right, this works out to an average of 2 unvaccinated people per hospital per week. Now, folks, if this is what you call a crisis, then we don't have a crisis of unvaccinated people. We have a crisis of misallocated taxpayer dollars. Next slide, please. Now let's take a look at some more data and see exactly how these vaccines have affected recovery rate. Now, this graph represents the effect of the vaccination on the population over time. So originally we were told that the vaccines would stop the spread. However, when the vaccinated cases began to exponentially outweigh the unvaxxed, the narrative quickly changed. But essentially the main goal of the vaccines is to reduce death rate and increase the recovery rate. So let's see how that's going. Now each line here represents a different age group, which is reflected in the legend at the bottom of the graph. The first thing you should notice is that 6 of the lines representing ages 0 to 69 cannot be distinguished from each other because they are overlapping around the 100% recovery rate. Now, I'm not sure why this demographic would require a vaccine to save their lives when it is clear that there is a minimal risk of dying. So let's take a look at the next 3 lines below, who represent the older population whose recovery rate ranges from 70 to 90%. Now, as you can see, the lines are almost completely straight across, which indicates that the vaccine has had virtually no effect on the recovery rate or saving lives at all. Next slide, please. Now let's take a look and see if these vaccines are causing more harm than good. Next slide. This is the vaccine adverse event reporting, which is found on the canada.ca website. Now, as you can see in the legend, the dark purple represents serious adverse reactions, which includes death and life-threatening ailments, while the light purple represents non-serious reactions, such as a skin rash and flu-like symptoms. Now, I don't have time to go through this in detail, but it is obvious that the vaccines are causing a lot of serious and non-serious reactions. Now, perhaps if this committee and Dr. Hergy would acknowledge these adverse reactions, people might actually trust you. But instead, you insist the vaccines are safe and effective for everyone, contradicting statistics reported again from your own government website. Next slide, please.
Rebecca, just to let you know, you have about a minute left, okay?
Yeah, I'm almost done here. So here are just 3 stories of people that I know personally who have suffered at the hands of these jabs, okay? One suffers from ongoing blood clots, which you can see in the bottom left-hand corner. Another thought her mother was going to die, and one described her reaction as hell. Now, unfortunately, I don't have time to go through them at length, but I would highly recommend that each of you read through these stories as they represent your own constituents. So by using your own numbers, we can see, next slide, please. Now, by using your own numbers, we can see that most people survive COVID. Most cases are not serious enough to require hospitalization. The vaccines are not saving lives, but rather causing more harm than good. So the question becomes, what are you going to do about it? Because let me tell you something, this ship is sinking, the truth is coming out, and when people realize the truth, they're going to be looking for somebody to blame, and that's going to be you, because you are the people they elected and that they pay to represent and advocate for them. So I highly suggest you muster up the courage you thought you had when you ran for these positions and you start speaking up for your constituents, because if you don't, history is not going to look kindly on you, and neither will the law. Any questions?
Thank you, Rebecca. I'll go to